Animals mean a lot to me. I've always grown up with animals. My dad had a dog when I was growing up, had a border collie, and I think it was probably back then when I decided, probably at the age of 9 or 10, I knew I wanted to be involved somehow. I started work experience at the age of 14 in a vet practice and never ever looked back since. I've been qualified for well over a year now. Back along, I do still have a very keen interest in orthopaedics, and I think one day I would still like to further that. Obviously, I've become a head nurse very early on in my career. Lots of nurses don't get the opportunities that I've been given here at Companion Care to become a head nurse so early on after qualifying. But I think for me personally, it's definitely been the way forward, and I really made the right choice. My favourite part of the job, probably the clinical. Yeah, I still love all the clinical work. Even though sometimes I have to sort of take a back seat a little bit more now because I'm getting much more responsibility within the practice itself. I don't get to partake as much as probably I would like. Again, that's all part and parcel of being head nurse. So, but yeah, definitely surgery and the clinical work. To anyone, I'd say absolutely go for it if it's really what you want. It is hard work. I studied myself for 4 years, but it's definitely paid off. I wouldn't look back, and if I could do it all over again, then I would. Anyone, I would just say get some experience, get your foot in a door somewhere. Even if it's just doing a couple of hours a week, just work experience, just get yourself in. Because I think a lot of people go into it quite blindly, and then they'll change their minds quite quickly, and I think you really, before you go into it, it's not something you should enter into lightly. It's a big commitment, it's a big part of my life. I love my job, animals are my life, and I think just really think about what you want to do, and if you want to do it, go for it.